Yes, good morning, doctor.
Yeah, good morning. Okay. I think as usual, we'll give the other people some time to join us. Okay. But while that is happening, if you do have any question for the early people who have joined, an opportunity to clarify one or two things, at least to benefit from joining early. So if you do have any clarification, please just go ahead and ask me now. At least that will be to your own benefit for joining early. Questions, clarifications, anything as relates to pregnancy. So no questions, no clarifications? Okay, somebody said that sometimes some part of my tummy gets hard and softens and she's at 31 weeks. That is what I will call Braxton Hicks contraction. Braxton, B-R-A-X-T-O-N, Braxton Hicks. And that is very common in the third trimester. And these are preparatory contractions for labor. As I always explain, imagine somebody that wants to go to the Olympics to run. Obviously, he can't just wake up one day and go to the Olympics. He has to do some preparation, running, gym exercises. So that is what the Braxton Hicks does for your womb. It's preparing the womb for the work of labor. And you should differentiate this Braxton Hicks from any other situation. That is because these Braxton Hicks contractions are usually, mark the word usually, painless. At most, a bit uncomfortable. It is never, never painful. If you do have any painful contraction or abdominal pain or abdominal tightening, please come into the hospital so you'll be evaluated. Braxton Hicks is usually painless. Okay, so that is that with Braxton Hicks. So any other clarification? So by 11:10 we'll start this. I discovered I have pile and 20. Is there any? Let me see that question again. Let's see that question. Sorry, I can't find where these questions are. Chat. Okay. I discovered that I have pile and I'm 23 weeks. Please, is there anything I can do to treat it? Okay. Someone also said my back aches terribly, especially the lower right. I'm 25 weeks now. What week do Braxton Hicks contraction can start from the second half of pregnancy. Usually we start from about 5 to 6 months. Okay, that is when Braxton Hicks will usually start, but it becomes more frequent in the third trimester. And you know, the third trimester will start from 26 weeks. Okay, yeah. And somebody asked a question now. Look at that, it has pile. And when you do have pile, it's as a result of the pressure in your tummy. Okay, increased intra-abdominal pressure will cause the pile to pop out of the anus. Okay, and that's why when women do have pile in pregnancy, which is part of some of the nuisances of pregnancy, we will tell them obviously to try to do as much as possible so that their poo comes out very soft. So you don't want to we don't want your poo to be hard because already there is increased pressure in your tummy already from the developing womb. So you don't want to add to the pressure by having a hard poo. When you have a hard poo and you need to go and push it out, that increases the pressure on your bum bum, and the pie will keep popping out more and increasing in size. So you want to make your poo as soft as possible by taking a lot of fruits, fluid, and vegetables. Fruits, fluid, and vegetables. Your poo must always come out easily. That is because the pregnancy on its own will predispose you to constipation. So your poo must do what? Must come out easily. Okay? However, there are some things we can do if the pile becomes painful. We can give you some pain relief. We can also tell you to go sit in water, warm water, to try to soothe that place, called what we call the sitz bath, S-I-T-Z, sitz bath. Okay, that also helps to manage the discomfort of the pie. But usually, pie will resolve once the woman delivers. That is because that consistent pressure of the womb is taken away. So that usually helps the pie to resolve. Let me look at other questions. We have 2 minutes to start. I was brushing some days back and I decided to brush my tongue, after which I vomited some yellowish bitter fluid which stopped after washing. But since then, I haven't had, is everything right? We know that yellowish bitter fluid is called your bile. Okay, usually when we do vomit, we vomit our stomach contents, right? That is what's in your stomach. But by the time we are finished vomiting what's in our stomach, then what remains is the bile, which comes from the duodenum. That is, after our stomach, you will now find your duodenum. Okay? So bile will come from there. You will now start vomiting bile, which is obviously bitter. Okay? Nothing to worry about. Okay? It means that your stomach was ab initio empty. Okay? So just go ahead and eat. Okay, and you are good. Okay, managing back pain. Well, we know the pregnancy on its own will cause you back pain because the pregnancy, as it grows bigger, it tends to fall forward. And there is a ligament that connects the back of your womb with that lowermost bone at your lower back. There is a connection. So as the womb grows bigger and tries to fall forward, what happens is that ligament or rope is pulling it backward. So there is tension. Okay, so that's why you have that discomfort. Okay, that's why you have that discomfort, and we always say that, okay, in severe situations, use a pain relief, but soft pregnancy pillows, putting it at your lower back if you are sleeping can also assist you. Your partner can also help you rub some cream, okay, to soothe your back, okay, or you can take some walk around. So those are just little areas you can help yourself with the back pain, but it is caused by that growing pregnancy. Okay, it's 9, 11, 10, okay. Also, someone asked, what can you do about body itching? There are many things that can cause itching for you. Okay, so it's important for you to see your doctor to know what essentially is causing the itchiness of the body. Do you take some drugs? Is there anything more sinister? But generally, with itching, you can it may also be due to heat, obviously, will cause itching. But it's important to identify why the person is itching. Okay? And once that has been identified, then one is able to manage it. If you do take Piriton tablets for 2 days and you are still itching, please come into the hospital and let's evaluate you. Okay, very quickly, we'll go into today's topic. So I'm sorry, I'm unable to take further pre-discussion questions. Okay, so we'll look at today's topic. We are talking about some danger signs in pregnancies. Okay. Okay, somebody said, I'm feeling some abdominal pain since 2 days. Please listen to today's discussion. It's a discussion about abdominal pains. Okay, you already have the Zoom meeting outline. Okay, so we'll go straight into those topics and quickly do justice to it. Okay, there will be more time for questions once we are done. Okay, danger signs, we're looking at abdominal pain, preterm contractions, bleeding per vaginum, draining. and fever. No, these are huge topics that will take some hours to finish, but we'll try as much as possible to touch on some salient points for you, okay? And hopefully questions will arise and we'll be able to put to bed any gray areas. Okay, abdominal pain. Why pregnancy? Many women, sorry, not many women, there are many reasons why a woman may have abdominal pain when she's pregnant. And because of these varied reasons, that is because a pregnant woman has the womb there. But do not also forget that there are so many other organs in the abdomen before the womb began to develop. There are so many organs in the abdomen before the womb began to develop. So all those other organs could also cause pain for the woman. And that is why it's not the gynecologist alone that will manage a woman with abdominal pain. It may end up being a multidisciplinary approach, whereby you need to invite the surgeon, the physician in situations, okay, to try to find the cause of the abdominal pain, or after having found the cause, then you send the person for treatment. That is because there are other organs in the abdomen. One, the appendix. A woman who have acute appendicitis in pregnancy. So when you have come before the doctor, even who is a gynecologist or even a general practice doctor, and is suspecting that this may be acute appendicitis, obviously he will refer you to the general surgeon who is going to manage your case even while pregnant. So it's not just the gyne that will manage women with abdominal pain in pregnancy. Okay, so the general surgeon can also manage that. Other organs, the liver is here on the right. Inflammation of the liver can cause hepatitis. The pancreas might also be inflamed, having pancreatitis. The spleen could rupture from trauma, maybe motor traffic accidents, intimate partner violence, or this our funny bad root. So splenic rupture, that is a rupture of the spleen, could also cause severe abdominal pain that would need surgical intervention. What of women with ulcer? She's pregnant, but that doesn't mean that she may not have ulcer, because she must have had it before the pregnancy. So the ulcer could cause her so much pain that needs intervention. So what I'm trying to say that when a woman has abdominal pain when she's pregnant, let's all not just think that, oh, it's just the pain is just localized to that womb and anything associated with womb alone. There are many other things that could cause pain for the pregnant woman. The ulcer she has, obviously, if she sees the physician, she's given anti-ulcer medications, and that pain will subside. That ulcer she has, if left untreated, can perforate. And that could cause a severe acute abdominal emergency needing urgent intervention. That could happen. In relation to the womb, a woman may have fibroids with the pregnancy, and that fibroid may be undergoing red degeneration. The fibroid may be undergoing red degeneration, and that obviously will cause pain for the woman, red degeneration. Also, a woman may have ovarian cyst in pregnancy. It's not only out of pregnancy that ovarian cyst may happen. It will happen right there in pregnancy, and that cyst may twist, called torsion. I've had to operate a woman at about 14 weeks for ovarian torsion. Because we were giving her antibiotics and pain relief, the pain was not getting any better, so we had to open up. So we managed her, and she came back later and had her baby in that same pregnancy. So you can see many things can cause abdominal pain for a woman. What of urinary tract infection can also cause abdominal pain. The kidneys are on your side, on your flanks. They could become infected, causing severe abdominal pain with fever. That is another cause of abdominal pain. Kidney stones, one will have kidney stones. That will also cause pain. So you see, there are many reasons why a woman may have pain. So it's not enough to, let me just send a message to my doctor. Doctor, I'm having abdominal pain. Oh, what should I take? No, let's not develop the habit of, because a proper doctor would take information from you and also go ahead to examine you and request for investigation. Please, let's listen to the messages, to the teachings for now. Time for questions will come so that we do not distract ourselves with questions. I see somebody is asking questions on PI, and I believe that abdominal pain in pregnancy is very important because at one time or the other, a woman may experience it, and the little information she has gained here may be beneficial to her, her friends, and to her relatives. So please, let's just take one or two. Let's take some time to just listen. We'll quickly finish so that we'll have rooms for any type of question as relates to pregnancy. Okay. Also, many times women may also have what is called a round ligament pain. Actually, that is common in pregnancy. Pain of the round ligament. Now, the round ligaments, as I explained, if you see the mast of an MTN or any of the carriers, you see that they have wires on the sides of that mast. It helps to stabilize the mast. So same thing with the round ligament, okay? It tries to hold the womb down so that it doesn't start fluttering in your abdomen. As the womb is growing bigger and bigger, that round ligament may be under tension because it is stretching. So that tension may cause pain for women. Most times, this pain is manageable, not too severe. But in some certain situations, that pain, just round ligament pain, is so severe as to warrant hospital admission. So as I was saying, it's not enough to call in that, oh, I'm having pain. What should I do? What should I take? Come in, they will take a good history because many other areas in the abdomen can cause you that pain. So there are specific questions your doctor will ask to determine where the problem may be arising from. Request for a scan, examine you, and any other investigation as may be necessary to determine what the problem is and how to go about it. Okay, so that is it with abdominal pain. Okay, bleeding per vagina in pregnancy. I will not dwell more on this because in the next antenatal class, there is a whole topic on miscarriages and placenta previa and placenta abruption and vasa previa, okay, which one of our doctors will take. Okay, so that will be covered in such a situation. However, it is important to know because I met a patient of recent who has been bleeding for a week, and felt that let her watch the bleeding, and she didn't come into the hospital until a week later, when a big blood clot fell out of her vagina. Bleeding in pregnancy is a danger sign. Don't just assume, oh, is it implantation bleeding? Is it just any other bleeding? Bleeding in pregnancy is abnormal. So you want to come into the hospital right away to be examined and have a scan done. So please, very important. So I will leave the bleeding per vagina and move on to preterm contractions. Preterm contractions. The last antenatal class I had I told us that a pregnancy is said to be term from 37 weeks to 42 weeks. So anything less than 37 weeks is called preterm. Term is 37 weeks to 42 weeks. 37 weeks is early term. From 39 weeks is full term. From 41 weeks is late term, and obviously from 41 weeks is late term, and after 42 weeks is post term. So that's how we usually try to distinguish between early term, full term, late term, and post term. But very importantly, term is 37 to 42. So anything below 37 is preterm. And we should also know that in Nigeria, the age of viability for our babies, meaning that the age at which we give the baby a chance of survival, is still 28 weeks. So preterm contractions, as it were, is between 28 weeks to less than 37 weeks. That is because anything before 28 weeks, and the woman is having abdominal pain, she may be having a miscarriage. So that is another cause of abdominal pain, right? Miscarriage. So it will be covered in the next antenatal session on miscarriages, bleeding per vagina. So that's why I'm not touching on it today, okay? So I'll stick with preterm contractions. That is a pregnancy that has gotten to 28 weeks, but before 37 weeks. And the woman comes with painful uterine contractions. Brachycephalic contractions are not painful. They are painless or at most uncomfortable. But when you start to have contractions, the tightening of your womb that feels painful, then obviously you should be worried. You should be worried, and you should come into the clinic right there, because there are many reasons why that will be happening. Fibroid degeneration can cause preterm contractions for a woman if not managed properly. That is because the degenerative fibroid may release some noxious substances that will stimulate the uterus. Such stimulation could lead to contractions, which, if not checked, can move on from preterm contractions to preterm labor. And what is the difference? A woman may be having contractions, painful. If those contractions are not quickly identified, meaning that if she did not come on time to the hospital, for us to quickly determine what is causing the contractions, what can we do to abort the contractions and stop that contraction, that preterm contractions will progress to preterm labor. And the difference is that in preterm contractions, the cervix is not open. But in preterm labor, the cervix is open. To mean that if you come with preterm contractions, we will obviously do a vaginal examination to determine if your cervix is open. Okay? If it's not opening, we are happy that, oh, this is still preterm contractions. Let's do all it takes to abort these contractions and preserve that baby, so the baby will grow bigger and bigger. Okay? Twin pregnancies or triplet pregnancies have a predisposition towards preterm contraction. That is because the uterus is over-distended. So it's stretched so much that preterm contractions could set in. Also, placenta abruption. You know, when the placenta is having a little tear from its attachment to the womb, and some blood seep into the muzzle of the womb, that blood will irritate the uterus. Such irritation may lead to preterm contractions and preterm labor if not properly taken care of. Also, anything that will cause fever, no matter the cause of the fever, will cause preterm contraction. So what will readily come to mind for you is what everybody will call simple malaria. And it's not just malaria. I treated myself some 5-6 weeks ago. Why am I having malaria again? As I always say, you know, the life cycle of the parasites is about 3 for falciparum malaria. It's about 3 weeks, 21 days. So because you treated yourself a month ago or 6 weeks ago, does not mean you will not have another malaria if you are bitten by a mosquito that deposits the parasite into you, which undergoes its life cycle. 21 days will be complete, and you will have another bout of fever and chills and rigor and body pains. Anything that will cause fever can cause preterm contractions, even the simple malaria. So for the pregnant woman, knowing that your immunity is low, your body cannot fight the parasites adequately by itself, you want to come out on time and ensure it is treated before it complicates the pregnancy with preterm contractions. Pneumonia, that is a lower respiratory tract infection, can also cause preterm contractions. As I said, anything that causes fever can cause it. Urinary tract infection. Women are pretty prone to urinary tract infection, obviously. Pregnant women are prone to it. So you want to ensure that you do not come down with urinary tract infection by ensuring you take a lot of fluids. Do not hold urine, okay, because urine that is held forms a good culture medium. It's like leaving urine in the side of the house. And by the time you come back by tomorrow, you will realize that it is smelling and it is getting infected already. That's what happens. So you don't want that to happen. You want to take a lot of fluids. Go pee at the right time. Okay. And if you do have any symptom that suggests, oh, when I go and pee, I think I have some little burning sensation. I have some little lower abdominal pain. You'll be tested for urinary tract infection and treated as appropriate. Okay. Also, genital tract infections, abnormal vaginal discharge. Okay. Lower abdominal pain, pain during sex would all be telltale signs of genital tract inflammation. So, and you know that the vagina, the cervix is very close to the uterus. You don't want any of such infections, inflammation to stimulate the uterus and cause preterm contractions and preterm labor with the delivery of a preterm baby. You do not want any of such to happen. So you want to try as much as possible to do what? To take care of anything that will cause fever and infection. Okay. And when patients come in with preterm contractions, we take obviously a good history from them, want to know the cause of these preterm contractions. And usually we would admit, we won't send you home because we know that the preterm contractions can go on to cause a preterm baby. And a preterm baby has a risk of staying in the ICU for very long, with the risk of even still not going home with the baby. So usually we will admit the mother with preterm contractions, do the necessary investigations, commence on relevant antibiotics as may be necessary. Okay, give her antibiotics and also anti-malaria as the case may be. So those are some of the causes of preterm contractions that you should know about. Okay, and please, we all know that preterm contractions is another cause of abdominal pain, right? Because the woman is not having painful contractions. That obviously is described, especially by first-time mothers, as abdominal pain. So, and that definition will necessitate them coming in for care. Okay, so we'll go to draining. Okay, draining. Which I will say is what I will call prompt. For draining, draining means the water that carries the baby has broken and the woman is leaking some fluid per vagina. So when the woman is draining, obviously she has broken the membranes that surround the baby and water is coming out. That is not a problem if it's happening in labor, because we know the signs of labor, right? We do have painful uterine contractions, passage of show, and draining of lipo, like draining of the fluid of the baby. So those are the three cardinal signs and symptoms of labor. So if that happens when the woman is 10 or in labor, I am not worried. However, when the woman is draining before the baby is 10, it's a big issue. And we already know time as 37 weeks to 42 weeks. However, also, there's a concept called pre-labor rupture of membranes. This woman is, let's say she's 38 weeks, we agree, 38 weeks, she's 10. And she has broken her water, but no painful contractions. So she presumes in her mind, well, since I'm not having any contractions, maybe I am not in labor. So she decides to stay away and do not come into the hospital. Obviously, what do you think when by the time she comes 2 or 3 days later, which we have seen? So it's not theoretical. We have actually seen that the woman draining, she's 38 weeks, meaning she's 10, but because she's not having contractions, and in her mind, she's waiting for contractions, she refuses to come into the hospital. By the time she's going to come, what will happen will be that that liquor would have become infected, which could lead to significant abdominal pain for her outside of contractions, would also lead to purulent, smelly, malodorous vaginal discharge, could already lead to fever for her, and may also lead to death for the baby and infection of her womb, which may prevent her getting pregnant ever again. So that's why when I'm trying to explain to women about the signs of labor, I do tell them, when you have broken your water, do not wait for anything. Come into the hospital right away. Do not wait for anything. Come into the hospital right away, because draining of your liquor is said to be prolonged after 24 hours. Meaning that your water broke and 24 hours you are not coming to the hospital. That is prolonged drainage of liquor. And as I enumerated for you, fever, discharge, death of the baby, infection of the womb of the woman, those are complications that could arise from prolonged drainage of liquor for a woman. So please, you drain your liquor, you are firm, or you are not firm, come into the hospital right away. Okay. Also, we do have a preterm rupture of membrane. That means you are draining before your baby is 37 weeks. That is, you are above 28 weeks or before 37 weeks, and you are draining. That is called preterm rupture of membrane. And when that happens, the causes are not too different from what will cause preterm contractions for you. Because when the woman goes into preterm contractions, that could lead to breakage of the water and draining. So uterine overdistension from twins, triplet pregnancy, or increased fluid, what we call polyhydramnios, can cause sudden breakage of the water. Anything that could cause fever, genital tract infections, even an abnormal lie, like people with breech, they have a tendency to break their water before labor starts. Because especially with footling breech, when the leg of the baby is presenting or the baby is in transverse lie, that could lead to breakage of the water. But if you are not taking anything home today, please take note. I break my water, or I assume my water is broken. You may not have, you do not need to be sure, don't worry. Let us decide whether it is your fluid or increased vaginal discharge that has caused that drain. So come into the hospital, a speculum will pass and will tell you to cough, to bear down, and we'll see fluid pulling into the vagina or coming out of the cervix. So let us make that determination for you. If you assume or you are sure you have broken your water, it's coming right away. That is because if not properly managed, the woman runs the risk of the baby dying and she not being able to get pregnant ever again. Okay. And the last thing, okay, fever. Okay. Many things can cause fever. And we've already known that fever can cause preterm contractions and can go ahead to cause preterm labor. So, and the most common things in our environment, maybe what we have eaten or drink, so what we have eaten or drunk, causing diarrhea or vomiting for us could go on to cause fever in gastroenteritis. Okay, malarial fever, typhoid, even the coronavirus, pneumonia. Any of these things can cause fever. Whether a viral illness or a bacterial illness, anything can cause fever. Once a fever is detected, irrespective of the cause, if not managed, can go ahead to affect the baby, leading to preterm contractions and loss of the baby. So if you do have fever and you think you have taken paracetamol 1 or 2 doses and it doesn't go within a day, please come into the hospital and let them evaluate you. Let's reduce the habit of saying, doctor, my body is hot, what should I take? The person has not examined you. He has not investigated you. What if he tells you, okay, oh, you have to go and buy anti-malaria, and the problem is not that. And God forbid, one loses the pregnancy. I say, but I called the doctor. So calling the doctor does not solve the problem. You come into the hospital where you'll be evaluated. Okay? So we'll stop here. So we'll take some time for questions before our hour is up. Okay, so if you do have questions, please unmute yourself, ask your questions. Okay. So we'll take questions now. Please ask your questions. Let me look through the chat, see whether there's anything. Someone said I'm 32 weeks, the baby normally moves more at midnight. I can't sleep. Also, my gastric these days is coming very well. I don't understand the question of my gastric these days is coming very well. But the reason why you presume that the baby is moving so well over the midnight is because that midnight is for you as a human being, as an adult who has gone to work during the day to sleep. So because you have laid down to sleep, so you are more conscious of the movement. I can assure you the baby moves during the day also, but because you are busy, you never took notes of that. Okay, since I'm 20 weeks, I'm feeling abdominal pains. Okay, so that is sorted out. Since 2 days, hope is normal. You can see what we are talking about. 2 days abdominal pain. My sister, it is not normal. Come into the hospital, okay, see your doctors, let them determine what is causing that abdominal pain. It could just be urinary tract infection. Why not? That could be causing that. If that is treated, then no more pain. We don't like abdominal pain in pregnancy. Okay, and if it's also due to round ligament pain, that will be determined from examination and proper pain relief given to you. Doctor, can pile affect natural delivery? No, I will not say because of a woman has pile, I will now go and operate on her. No, I wouldn't do that. Okay, because it's not a clear-cut indication for me to go and operate or to bring out the baby. But I do know that during the pushing stage, when the woman is now 10 cm and we take her to go and push, obviously the bearing down effort will do what will cause more prolapse, but that will be transient, obviously, and would expect resolution of the pie as the weeks go by in pregnancy. Okay, and also let's not forget that pie is also managed by the general surgeon. So once you have delivered, or even while still in pregnancy, it could be co-managed with the general surgeon to try to help resolve these problems. Okay, so Mrs. Fadu Jutimi, she's raising. Please go ahead, ask your question, please, Mrs. Fadu Jutimi. Somebody raised up her hand. Please go ahead, ask your question. Please unmute yourself and ask your question, or is it impossible? Hello? Can I be heard? Can anybody hear me?
Yes, I can hear you.
Doctor, can hear you.
Yes, we can hear you.
You raised up your hand. Please go ahead.
Yeah, well, please, what's the implication of when you maybe probably you do a scan and you're told the placenta is under?
Okay. That is called a low-lying placenta. And we call it a low-lying placenta if it is before 28 weeks. Don't forget that 28 weeks is very imperative because that is your age of viability for us here in Africa. Okay? So low-lying placenta before 28 weeks. Once it's 28 weeks and above, we call it a placenta previa. And that is a placenta that is occupying your doorway. You know, the only doorway out of your womb is where your cervix, right? So a placenta that is close to that doorway or crossing that doorway, effectively blocking that doorway, is called a low-lying placenta or placenta previa. And depending on the grade of the placenta previa, or what we call a low-lying placenta, we will offer you a cesarean section if it's a major placenta previa. Okay, so the obstetric indication, so the obstetric correlation of that to you is that I may be requested to have a cesarean section because of a low-lying placenta. Okay?
Okay.
And also a low-lying placenta may also cause bleeding per vaginum for the woman. But as I told you in your next antenatal class, there will be a session on bleeding per vagina, placenta previa. Please tune in, listen to that on that day and gain more, okay? But it will not be too different from what I just explained now. Okay, so somebody else raised her hand.
Doctor, sorry, I'm Mrs. Fadojuti. I was having issue with my phone.
Hello, I can't hear you.
I'm Mrs. Fadojuti. I was having issue with my phone before. Sorry for that. Can you hear me now?
It's poor, but go ahead. Let's see whether anybody else who hears can re-echo.
Okay, I was saying that is it possible for me to treat malaria 3 times before birth? Because I'm just 27 weeks. They've already treated me malaria 2 times, and they gave me another one yesterday to take.
Yes, you can. You can. No, I just explained to you. I mentioned something when I was talking about causes of preterm contraction and fever. Okay, I said the most common environment is what? Malaria fever. A human being can have malaria every month. Reason being that the parasite has a life cycle of 21 days. So if I treated myself 4 weeks ago and I got home, I was bitten by mosquito again, obviously they are going to go through that life cycle. 21 days later, I will develop fever. Okay? So it's not that complete. So prevention is important for you. Okay? Don't say because I've taken anti-malaria, you won't spray your house. Your necessary nets are well done. Nobody's opening doors down. So those are all important things you should do to prevent mosquito bites. Okay?
Okay, sir. Sorry, sir. The second one, the multiple pregnancy.
Yeah.
Is it possible for me to take blood builder? They gave me ferrets. Is it possible for me to take 2 tablets per day?
Okay, like double dose, right?
Yes, sir.
Yes, you can do that in multiple pregnancies, okay, because the iron requirements for twins and triplets is already going to be higher than for a single pregnancy, right? So your doctor obviously would have done that for you, but it's something you can do, okay, to try to build up your blood because the babies need more iron than for a single baby. So please, it's indicated you can do double dosing.
Okay, so I'm sorry, and I always feel dizzy when I feel dizzy. I feel so weak. I feel so weak when I stand, especially when I stand for a long time.
Well, pregnancy on its own at times could be tiresome. There are some days you wake up very strong, and there are some days you wake up pretty weak. Okay, but 2 things that will readily come to mind if you feel unduly weak and dizzy and tired most times. Okay, apart from this basic side effect of pregnancy, could be low blood volume, low sugar. So if you go into the clinic the next time, please will request to have a blood sugar done for you, okay? And also to recheck your pack cell volume. If those two are fine, then may just be the side effect of the pregnancy. And that's why when women are pregnant and they go about their duties, we just say, okay, once you have done some things for about 45 minutes to 1 hour, just try to sit down, regather your momentum before going at it again, okay? But if you stand for too long, obviously you get tired, okay? But those two things should be checked, okay?
Thank you, sir.
Let me check one question here. Somebody said, please, doctor, is there any, sorry, where was I? Okay, is there any way I can manage my spitting? Okay, well, as I have always said, we have not found a perfect solution to why women will be hypersalivating in pregnancy, but we can readily help if the woman is vomiting so much in pregnancy, okay? But that hypersalivation, pretty difficult right now. So we've not found a perfect solution for the hypersalivation of pregnancy, okay? Part of the pregnancy symptoms, so far you're not vomiting and losing so much electrolyte, we would just say hydrate yourself. If you are vomiting so much, usually we admit you and try to hydrate you by giving you a drip and give you drugs to prevent vomiting, not to prevent spitting or hypersalivation, to prevent vomiting. Usually this hypersalivation or vomiting and nausea of pregnancy will get better by the time the woman gets to about 15, 16 weeks. Please, at what week should I expect the first kick of my baby? Okay, generally about 20 weeks, you should feel that, especially in first-time mothers. Okay, in women who have delivered before, they may want to feel it earlier than that at about 19 weeks or 18 weeks. But generally, I would say 20 weeks, you should be feeling your fetal kicks. And that doesn't mean that the baby is not kicking, because when we do scans at about 14 weeks or 12 weeks, I keep telling them, you can see that the baby is kicking, but you can't feel it. You see, it's difficult for someone to kick you through the water and for the kick to be very effective, right? Because it's not going through the air, okay? So by 20 weeks, the baby's bones are getting stronger. So when it moves through the water, you feel those butterfly kicks. And by the time the baby is getting to about 28, 30 weeks, it kicks you. Sometimes you may feel some pain and discomfort. Good morning, doctor. Is there any instrument for vaginal examination besides hands? There are instruments for us to use to examine the cervix, okay? It's called the speculum, and I'm sure that some of us have seen it before, where we used to put it inside and open it. We open the vagina so that we can see the cervix. There are reasons why we may use a speculum to examine the vagina, but a speculum is a little bit more uncomfortable than doing a digital vaginal examination with our hands. That is with the gloved hand. The gloved hand is less uncomfortable. Okay, so I don't know why she has raised this question about is there an instrument to examine the vagina aside the hand? But if you want to check the cervical dilatation in labor, why the one is in labor, obviously you won't be using instruments to keep opening, because you want to use your fingers to carefully assess the cervix. So if she's talking about labor, well, the gloved finger is still what we use to assess the cervix. We are not actually assessing the vagina, it's the cervix we are trying to assess to see whether the cervix is open and to what extent it is open, okay? If I'm going to take a vaginal swab for infection, obviously I will not use my finger to do the examination. I will put a speculum to do the examination. Doctor, can you say something about cervical polyp? Well, polyp is a small growth. It's not like, it's a small growth. It could be anywhere, either on the cervix, and be in the womb, in the endometrium, okay? And it's different from a cervical fibroid, because polyp is softer than a cervical fibroid. And a cervical polyp can cause bleeding when you have sex, okay? And can cause bleeding outside of your normal menses. So when you see bleeding outside of your normal menses, obviously you want to come in. A scan will be done to check from the womb, Then that speculum, that instrument I'm talking about, will be used to expose your cervix and take a look at the cervix. So just looking at it is enough to tell me that this is a polyp, okay? And once a polyp is detected, obviously, and is already causing you symptoms of bleeding, you have sex with your husband, bleeding again, obviously, and you would obviously need to have that polyp done. It's a procedure called polypectomy. We use that to remove the polyp. So it will be done in the theater, and a woman is able to go home at about that same day for small polyps. So it's a day case. She does it that day, and she's still able to go home for cervical polyps. Okay, any other question? Let me see if I missed any. Okay, doctor, okay. How many hours does labor take for the first-time mom? It doesn't matter whether you're a first-time mom or you're a third-time mom. Okay, the rate of cervical dilatation, is a constant, okay? Whether you're a first-time or a second-time mom, we expect the cervix to dilate at 1 centimeter per hour. Whether you're a first-time mom or a second-time mom, though we do know that for people who have delivered before, they may want to dilate at about 0.8 centimeter per hour. However, on the average for everybody, 1 centimeter per hour. So once you have come in labor and you have determined that you're in active phase of labor and you have 4 centimeters, we start to monitor that 1 centimeter per hour dilatation. And we'll say we don't want the labor to last more than 12 hours. Okay. So is there any effect of not having sex through the 9 months of pregnancy? Well, one effect that comes ready to mind would be psychological. Obviously, you don't want to deny your husband his conjugal rights, obviously. It helps for better bonding. So you wouldn't want it to be said that Dr. Ikhile said, oh, nothing happens if I don't have sex, so go and sit down somewhere. Okay, so psychological issues, mental issues, sometimes could be very bothersome than physical issues. Okay, so I will not concur to not having sex while you're pregnant, except for clear-cut medical reasons. Like a woman who is bleeding PV, and I assume, and we have done a scan and she has a low-lying placenta. That is a placenta that is close to that cervix. You know that when you have sex, that cervix is going to do what? That placenta may bleed. Obviously, we'll advise the couple. The husband will be called in. He will see the placenta and say, this is the problem. You can't go ahead having sex because the woman may bleed, lose the pregnancy, or even lose her life. Okay, so those are some reasons why you will not have sex. Okay, and also if the woman is not mentally up to it. Okay. However, on a physical side, there may not be any side effects to not having sex in pregnancy other than psychological, other than marital disharmony between you and your partner. Okay. What month can sex be? What month can sex be stopped in pregnancy? Sex can be continued up to the day you deliver. Okay. Okay. Can be continued up to the day you deliver. Okay, is there a question? Okay, I thought somebody was trying to ask a question. Okay, I think we have exhausted all these questions. I don't think I'm missing out any questions here. Oh, okay, somebody.
You're not missing out anything, Dr. Ikhile. You have done so well. Good justice. Okay. So thank
somebody
you.
said I didn't answer. Thank you, Ma. Somebody said I didn't answer her question on pile. I think I have answered that. I remember very clearly.
Yes.
I said that pile is not an indication for me to go and section you. Okay, it's not an indication for me to section you. Okay, so you can have a vaginal delivery if you have pile. Okay, to be managed once you are delivered with the general surgeon. Okay.
Sir,
okay.
Can you hear me?
Yes, I can hear you, madam.
Good morning. My first child, I had an emergency surgery.
Okay, yes.
Baby's head was not coming out.
Okay, ma'am.
So I told, when I came for antenatal, I told them that I'm trying to have a vaginal delivery for my second baby. Is it possible?
Yes, I answered this question in the last antenatal class, talking about vaginal delivery after cesarean section. There are some criteria, madam, that you need to fulfill for your doctor to allow you to have a vaginal delivery. Okay. Number one is that your baby should not be more than 3.5 kg. Okay. Also, your baby must come with the head. And you must fall into labor spontaneously. Nobody is going to induce you. Okay. And the reason for you doing the 4 CS must not be a recurrent reason. If it was due to the fact that there was cephalopelvic disproportion, meaning that there is a disproportion between your baby's head and your pelvis, meaning that if for whatever reason you went because they felt you could not deliver a 3.3 kg baby, obviously your next baby that may be a bit bigger, about 3.4, will be difficult to come out. So that might be a reason. So all these reasons are criteria that must be met before a woman has a vaginal delivery. Okay, so you discuss with your doctor, they will go through this criteria with you. Okay, and if you do not meet any of these criteria, obviously you'll be counseled to have another cesarean section. Okay. What was the weight of your last baby?
3.42.
You can say 3.42 already. So, and we know theoretically that our second and third babies obviously have the way of growing bigger than our first babies. Okay, so we are looking possibly at 3.5, 3.6 for this one. So already, you most likely may not be meeting one of the very salient criteria for this delivery. So please keep an open mind, okay, so that you do not go run to a place where they will force you to try to deliver the baby and God forbid a uterine rupture. Okay?
Okay, sir. Thank you.
Yeah. Someone said cause of persistent headache. Well, headache may come occasionally, okay, but when it's becoming persistent, you need to be serious and be evaluated. Okay, we don't want persistent headache. What necessary with CS be done? Can you wait till 40 weeks? In Nigeria today and in Africa, we do elective CSs at 38 weeks. Elective CS is usually done at 38 weeks in Africa. However, some people are attempting to be done at 39 weeks now because I already said that early term is 37 weeks, full term 39 weeks, late term 41 weeks. So some people are already saying, okay, let me do my CS at full term at 39 weeks. But most gynecologists in Nigeria, we still do elective CS at 38 weeks. Not many will cross to 40 weeks to go and do the elective CS, okay? What point in antenatal is blood level regularly monitored? Hello, I'm hearing some feedbacks, a lot of feedbacks. Please, let's mute ourselves if we are not asking questions. Please, thank you. At what point in antenatal is blood level regularly monitored? Blood level, I guess you are talking about your pack cell volume, possibly, okay, your blood level. Okay, you know, don't forget that it is done at booking, okay? And when you do come to the antenatal clinic, so far you are using your blood products regularly. There may not be any need to do it until late in pregnancy or in early labor, okay? And that's why when you do come, at times, the doctor will say, I want to check your eyes, or let me see your tongue to check whether you are pale, okay? If any of these things are there, he may want you to go, madam, please go repeat your blood volume as an indication of whether you have been using your drugs very well. But if you have been consistent with your drug use, blood volume will not be regularly checked until maybe in early labor or late in pregnancy. Okay. Please, I'm a first time on what is the normal weight for a vaginal birth? There is no hard and fast rule to a normal weight of a baby for vaginal delivery for a first time mom. An average weight baby is said to be a baby from 2.5 kg to 3.5 kg. Okay, that's average weight baby. Average weight baby. However, I've seen some first time mothers deliver a 4.5 kg baby. But the truth of the matter is that is exceptional situation. Those are exceptional situations. Once a baby for a first-time mother is getting to 4 kg, I'm always very, very suspicious of the fact that she may not be able to push that baby out herself. So I would say normal weight, 2.5 to 3.5 kg, will do well for you to deliver vaginally. Please, doctor, how often is this class conducted, and so as not to miss the next class? Okay, antenatal classes is done fortnightly, so every 2 weeks. So the next class will be, today is June 12th, plus 14 days, that will be June 26th, okay, every 2 weeks. Okay, so doc, why do you have to do CS earlier? Is there any reason? Of course, there may be reasons for why I want to do a CS before my 38 weeks. It could be that the woman has elevated blood pressure that is not responsive to medications, and I'm worried that I don't want her to develop eclampsia or preeclampsia. I will go in on time. Okay, or if for whatever reason the woman has low-lying placenta, abruptio placenta, sorry, low-lying placenta, that is placenta previa that we talked about the other time, and she has had 1 or 2 bleeding per vagina because of that low-lying placenta. So as soon as the woman is 37 weeks, meaning that the woman is now 10, I will run and quickly go and bring out the baby because I don't want her to go and bleed again heavily while she goes into labor pains, which could cause problems for the baby and the mother. So that may be a reason for me to go and go in on time. So if you are doing a CS before 38 weeks, obviously you have the right to ask your doctor, oh, doc, why are we doing it before 38 weeks? It may also be to logistic reasons. There are sometimes out of logistics because I operate in Adeni Jones on Thursdays and in Amole on Wednesdays, and 38 weeks may not be exactly feasible. So it may be 38 weeks, 3 days, or 37 weeks, 4 days, or 5 days. I will take those days, okay? So it's not a hard and fast rule. The baby is said to be term from 37 weeks. Okay, I think we have crossed the hour mark, so we have done very well. Should one be worried if no baby kick in a whole day, but baby movements are fed? Well, when we take fetal kicks and fetal movement is one and the same, okay? Baby moving, baby kicking is one and the same. Would it be harder for a younger woman to push a baby than older woman? No, it will not be harder. Actually, it should be easier for a younger woman. Reason being that the younger woman is stronger. I would expect a 25-year-old lady to push stronger and harder than a 40-year-old woman because she has more strength than that 40-year-old woman. Okay, thank you. So what is normal weight gain in pregnancy? Average of 12.5 kg, okay? Maybe more, maybe less, but average of 12.5 kg is the weight gain in pregnancy. So thank you so much, everyone. We have exceeded our time. So God bless you. I think we have done justice to the several questions that have come our way today. So
You have done it.
26th of this month, okay? We expect all of us to be there. God bless you all. Have a beautiful June 12th. Okay,
And you too.
Stay safe out there.
Thank you,
right.
doctor. Thank you. Have a nice day.
Stay safe.
Doctor.
Bye.
Bye.
Bye.